Coronary Angiography. This video, I will explain the differences between a right heart catheterization and a left heart catheterization. The main difference is the path of the catheter through the heart. Right heart catheterization, a catheter is inserted into a vein in the arm or groin. Left heart catheterization, a catheter is inserted into an artery in the wrist, arm, or groin. Right heart catheterization and left heart catheterization are two different procedures used in cardiovascular diagnostics, and they differ primarily in the area of the heart they assess and the purpose of the procedure. Both can be part of a coronary angiography procedure, but they focus on different aspects of heart function. Here's a breakdown of their differences. The purpose of right heart catheterization is used to assess the pressure and oxygen levels in the right side of the heart and the pulmonary circulation. It helps diagnose conditions related to the right heart, such as pulmonary hypertension, heart failure, and congenital heart defects. Right heart catheterization can be performed through the femoral vein in the leg, the internal jugular vein in the neck, or the antecubital veins in the arm. A catheter is inserted into the vein and advanced to the right atrium, right ventricle, and pulmonary artery. During the procedure, measurements of pressure and oxygen saturation are taken in these areas. A pulmonary artery pressure measurement using a catheter is often part of right heart catheterization. The procedure typically uses a balloon-tipped catheter to measure pressures in the right atrium, ventricle, and pulmonary artery. This is often referred to as a Swan-Ganz catheter when used for pulmonary artery measurements. Indications for right heart catheterization: pulmonary hypertension, right heart failure, evaluation of congenital heart disease, assessing heart-lung interactions in some cases. Let's take a moment to look at the left heart catheterization. Left heart catheterization focuses on assessing the left side of the heart and the coronary arteries. It is primarily used for evaluating coronary artery disease, heart valve function, and the left ventricle's function. Procedure: a catheter is typically inserted through the femoral artery, groin, or radial artery, wrist, and advanced into the aorta, and then into the left side of the heart. From there, it is directed into the coronary arteries to visualize blockages or narrowing. The catheter may also be used to measure pressures in the left ventricle and aorta. In coronary angiography, contrast dye is injected to visualize the coronary arteries. The procedure uses a catheter designed for accessing the coronary arteries, often called a coronary catheter. Contrast dye is injected through the catheter to create X-ray images of the coronary arteries. Indications for left heart catheterization: suspected coronary artery disease, heart valve assessment, left ventricular dysfunction, interventional procedures such as angioplasty, stent placement. Key differences between right heart cath and left heart cath. Right cath assess the right side of the heart and pulmonary artery. Access site: typically use femoral vein, jugular vein, or antecubital vein. Purpose: measure pressure and oxygen levels in the right heart and lungs. Catheter placement: right atrium, right ventricle, pulmonary artery. Indications: pulmonary hypertension, right heart failure, congenital heart disease. Left catheterization assess the left side of the heart, coronary arteries, aorta. Access site: femoral artery, radial artery. Purpose of left cath: evaluate coronary arteries, left ventricle, aorta, and valves. Catheter placement: aorta, left ventricle, coronary arteries. Indications: coronary artery disease, heart valve disease, left ventricular dysfunction. In summary, right heart catheterization is focused on assessing pressures and oxygen levels on the right side of the heart and in the pulmonary artery, while left heart catheterization is used to visualize coronary arteries disease, heart valve disease, measure the blood flow and pressure in the heart, also perform therapeutic procedures, such as balloon angioplasty or stent placement to open narrowed or blocked arteries. And that's a wrap for this video. More contents on coronary angiography procedures to follow. Please hit like and subscribe if you like this channel, and if you haven't done it so. Thanks for watching.